I'm Dr. Emma Morton, and I'd like to warmly welcome you to today's CREST-PD Talk PD event. I'm speaking to you from Vancouver, British Columbia, the traditional, ancestral, and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh nations. We have a lot of new viewers joining us today, especially from Mexico, so thank you everyone for coming. This is the 24th Talk BD event hosted by CREST-PD, a collaborative research network dedicated to improving and sharing knowledge about bipolar disorder. By collaborative, I mean that academics, clinicians, and people with lived experience and their families work hand in hand to research ways to live well with bipolar disorder and share the results of that work back with the community through events like this one. Today, our guests will be discussing psychosis, a state where people's experiences and thoughts do not align with reality. Psychosis can happen to many people with bipolar disorder, but unfortunately is not often discussed openly and can be very stigmatized. So we're hoping to shine some light on this important issue today and importantly, bring some hope to discussions of this challenging topic. We are extremely fortunate to hear from our guest speaker today, psychiatrist, researcher, and a member of the International Society of Bipolar Disorders Board of Directors, Dr. Manuel Sánchez de Carmona. We are also joined by Victoria Maxwell, an award-winning mental health speaker and performing artist, and one of the original CREST-PD members. Thank you both for joining us today. Before we move into some more detailed introductions with our guests, I wanted to note a couple of important things related to today's topic. First off, we're aware that psychosis and other diagnostic terminology may not be the terms which best reflect the way everyone relates to or explains these kind of experiences. Please bear with us if the language that we use doesn't align with the language that you use. Although we do our best to be inclusive, we have limited time today and our speakers bring their own clinical, research and personal experiences to this topic. So the language and treatment approaches that we talk about is going to be influenced by that. The second issue I'd like to acknowledge is that today's topic can bring up some very challenging memories for people who have experienced psychosis or hospitalization, other treatments. There can be a lot of distress associated with that. And you can also bring up distress if you have had loved ones go through this experience. Talking about psychosis can also bring up anxieties about what might happen in the future. So I'd like to ask everyone who's listening to please be gentle with yourself if today's topic brings up uncomfortable thoughts or feelings for you. And if you are experiencing distress, the resources kit that we'll be sharing with everyone in the Zoom chat and in the YouTube comments will also include some crisis supports that you can consider reaching out to. So with that covered, let's move into some introductions. So I am a researcher at the University of British Columbia. I've been working with the CREST-PD team for a number of years now. At the moment, we're working to build and evaluate a new self-management app to help people optimize their quality of life. And hopefully we'll get a chance to share that link with you later on today. Here at CREST-PD, we try to practice what we preach about work-life balance. So when I'm not working on that project, I like to get outdoors as much as possible. At the moment, I'm trying to fit in as many hikes around British Columbia as I can before the rain and the snow returns. I'll now pass the mic to Manuel to introduce himself. We'd love to hear a little bit about where you work, what you do, and as well, one non-work thing that you enjoy in your downtime.
Hi, Emma. Hi, Victoria. I'm very happy to be here. So excited to work again with CREST-PD, which I love personally. I am currently based in Mexico City. I am a psychiatrist. I've been treating patients with bipolar illness for more than 26 years. As you said, I'm a member of the ISBD, that's the International Society for Bipolar Disorders. I am currently a past president. I was president for 4 years. Now I'm working in the board. Currently working also on our next meeting is going to be in Chicago 2023. And it's a society that's been working for more than 20 years, helping in education, research, and knowledge of BD. And we have members worldwide. We have 27 active chapters. And I welcome people who are following me that I know that they will be joining this session. Besides the work that I do, which I love, I also love art. So I'm passionate into reading and researching about art, history, music, whatever. I love art, and I try to make a connection between my practice and the creativity that you see a lot in the disorder.
Thank you, Manuel. You will be very interested in the topic of our next Talk BD session, although I'll introduce that more at the end of today. Victoria, welcome once again.
Oh, thanks so much. I'm really glad to have you here. Some of you may already know who I am. My name is Victoria Maxwell. I'm a person with lived experience. I live with bipolar disorder, anxiety, and psychosis. I'm a keynote speaker and a performer. I just perform my own one-person shows about my experience with mental illness and recovery. I've been a member, as Emma said, from the beginning of CREST, and I'm also a strategic lead advisor for the BCMHSUS, which is the British Columbia Mental Health Substance Use Services. And I do like to acknowledge that I'm joining you from the unceded ancestral lands of the Coast Salish people, the traditional territories of the Shashala First Nation and the Squamish First Nation. And I really do like to emphasize how important these territories have been for me, particularly in my recovery from mental illness, and they still hold a very important part. On a personal note, more recently, I have started being very committed to meditation. So I've done some training and have started doing a practice every day of Vedic meditation. So I found it really beneficial for both my mood and just overall well-being.
Thank you, Victoria. It's once again a real pleasure to have you here, and I'm really looking forward to hearing yourself and Manuel talk about this really important topic. We also have our behind-the-scenes helpers, Caden and Bryn, helping out with the chat and our Facebook and YouTube streams. So we have people today joining us by Zoom, as well as watching live on YouTube. If you have questions, please pop them into the Zoom Q&A box. You can also post them on a YouTube comment if you're watching that way, or anonymously by the CREST-BD Talk BD page. And we will try to get to as many as possible after the main presentation. But for now, I will hand it over to Manuel and Victoria.
Excellent, excellent. And first of all, I want to say that I was very excited to know that the topic will be psychosis, because it's a very common mistalk topic. I think that is very frequent. It's more than 50% of the patients with bipolar disorder have psychotic symptoms during their illness. I want to say, first of all, that psychosis is not an illness. It's a mental state that may be present in several illnesses. For example, schizophrenia, dementia, postpartum depression, they all can have psychotic symptoms. In bipolar illness, it is frequent that you can see psychosis in either mania or depression or mixed episodes. The main features with psychosis are delusions and hallucinations. Delusions, as you know, are ideas or beliefs that you have disconnected from reality. They frequently are congruent with your mood. For example, with mania, it's common to see them that you feel more powerful, more creative, that you have communication with God, that you have extra powers of grandiosity, but also with paranoia, with delusional symptoms that can make actually very scary feelings of being followed. On the other side, depression can also have psychotic symptoms that are congruent with negative feelings, negative thoughts, catastrophic things that are going to happen, beliefs that that people may hurt you, etc. So delusions can be present in both. And I also said hallucinations. They can be visual, auditory, tactile, and these symptoms are very frequent. People don't say it because they feel that they may be misjudged. And I want to let the audience know that it's key to open up these topics, because the prognosis and the treatment can actually change if you open up the symptoms. What do you think, Victoria, about this topic? How common they are in your own illness, and What are your feelings and thoughts regarding psychosis?
Yeah, well, I've experienced psychosis several times. In terms of sort of that mood congruent, I don't know if there's a fortunate side around psychosis, but I experienced it with mania. So it was not as frightening as I think it can be with depression. For myself, I really had a lot of it when it was escalating. I had a lot of experience where it felt very spiritual and actually personally meaningful to me, not to the point where I felt like I was God or I was Jesus Christ or anything like that, but where there was a real sense of oneness. But then it started to escalate to a point where it really was a florid manic psychosis. And that's where I was starting to sort of feel like I could drive my car with my thoughts. And unfortunately, I tried to, and of course, ran out of gas and then couldn't move the car anymore. So yeah, I think it's not very common. I haven't talked to a lot of people who've had psychosis, and I know at times there's been a thought perhaps that it might trigger bad feelings or something like that. But for me, it's important to talk about, to validate them, to understand, to also understand what the sort of preliminary warning signs might be, so I can learn from it.
Let me catch up here because I think that I have to make clear one point. It is a progressive state because it is very easy for us to think about someone having visual or auditory hallucinations and totally delusional. Let's say that's the maximum psychotic state, but it begins gradually. And think about any manic belief that you are convinced that you are super powerful or that you are going to, that is the beginning of psychosis. That is why I told you that almost 50% of patients with BD have the symptoms. It's not that reported because many people don't know about it. And actually they think that they should be actually hearing voices to say, I'm psychotic. So you have to see this like a progressive state. And that is why this conversation is so relevant, because here's the secret. The more early you detect it, the easier it is to treat. So that's the key factor here. That's a game changer here. I want all the audience to know, patients, family member, caregivers, that we have to be very accurate in our feeling. How am I feeling my crisis? And what are the first signs that actually happen? I have also one topic here, Victoria. No one knows for sure why some patients have the symptoms and who doesn't, who gets it and who does not. Dopamine has been the neurotransmitter more related to it, but no one can easily say what is the exact reason why it happens. Substances can be related. Some alcohol, drugs psychedelics can actually worsen the symptoms. So substances and alcohol can be one of the key factors here. But for sure, no one knows. The key point here is that report them as soon as possible, because you know something, they are 100% treatable. We can decrease psychosis if we detect the psychotic symptom in time.
And Emmanuel, that's a great point, because the interesting thing is that initially, when I was in that beginning stage, when it was starting to elevate, I was sort of in two worlds at once, where I sort of knew something was off, and then at the same time, then I was sort of in that world. And it's true, most of my symptoms of psychosis are delusional. I might have some visual hallucinations, and I've had a couple of tactile ones, but most of them have been delusional, where I'm having these fixed beliefs. And the interesting thing is, of course, at one point when I had a fairly recent psychosis, I guess it was a year or two ago, it was still very, very early on. And because I was sort of half in and half out, I was in conversation with my then husband, and we were talking, and I could actually tell him what I was thinking. he would ask me, well, do you think that's true? And then recognize that, okay, that's a delusional thought, so we better get some help. And that was really pivotal, because just like you said, the earlier it is, also the less damage it can do, and less disruption to a person's life. Because at a certain point, when I was fully in psychosis, no one could talk me out of my beliefs, because they're my reality. Just like if you're in Mexico, that's your reality. If someone told you you weren't in Mexico, you wouldn't believe them. So that's the same thing. So it's really interesting, the whole experience of it, and how to learn how to navigate it, and navigate it with compassion.
I love what you said, because actually it is progressive, and it may begin, like, as you said, on and off. You're not psychotic 24/7. So you may be psychotic some moments in the day. And actually, it's exactly as you just said, it begins. So as you just said, you had like this brief consciousness that this idea may be delusional. And that is a moment to go for help, to increase the medication, to call your doctor. Because as I said, they're 100% treatable. You can control the symptoms very well with medication. Antipsychotics actually work to decrease the delusions, erase them, and also the hallucinations. But the key factor here is to give them on time. As you know, mood stabilizers like lithium, like valproate, they make the mood stable, but they do not have any psychotic features. Lithium may help a little bit, but you may need to add an antipsychotic to control the symptoms. Olanzapine, risperidone, paliperidone, aripiprazole are some of the names. Each doctor should decide for each patient, what is the best antipsychotic medication. In many cases, I can say that you're going to take them only for a brief period of time. As any psychiatric medication, you have to be tapered off gradually to make absolutely sure that the psychotic symptoms are off. So here the point is that acknowledge that it's a very common symptom, more frequent than you may think, that it begins gradually, and it begins in an on and off pattern. You're not going to be psychotic the whole day. And it may bring you this kind of feeling that is totally real. So it's so important to communicate this to your loved ones, because they can actually help you a lot to say, Manuel, this is actually not you, or this is not actually what you think about this topic. And that is the way that you have to share all these things to them, because they can actually help you to recognize the earlier, the better.
Yeah, and interestingly, as you were saying that, what I thought is sometimes what I call psychosis is non-shared reality or parallel reality, because then it gives a sense of what it actually feels like, that it's this other kind of reality that someone's experiencing. So instead of psychosis, which somehow you might, I don't know, want to try to talk somebody out of, or even I was going to say be afraid of, but somehow it doesn't lend itself to understanding what a person's experiencing when you just say psychosis, versus sort of non-shared reality or parallel reality. It may not give the experience, but it gives the understanding that this is real for the person.
Exactly. This is a key point here. And actually, this is an advice to all. If you have someone with psychotic symptoms, never say those things are unreal, because they're real for their brain. They're actually happening. The perception is happening inside their brain. They're not happening outside, but they're happening in your own brain reality. So that is totally true. You have to say they are happening in your brain. You are experiencing on the same level as I'm talking to you now, but they're not happening outside. So that's why you need the medication. So I would like to share some tips that you have to do to handle these symptoms. If you have them, or if you have or if someone next to you has them. So let's begin with yourself. What do you think is one of the key factors here if you experience to feel anything like this? What would you advise, Victoria?
Well, I guess one of the first things is from my own experience was that my sleep was disrupted and it was very obvious. And so when that, it's not in terms of how mania interferes with sleep, but with noticing what my typical warning signs of mania are, because that's where I usually go into psychosis. For some people, it might be depression. The first thing is looking at whether I've been taking my medication. I mean, honestly, that's one of the things. And then going and connecting with my social network, so a trusted loved one, to help me get to probably either, if it's serious, an emergency department, or connect with my psychiatrist. And so I'll let you continue, and then I can share sort of practical tips that
Excellent.
That's not to do with acute stages.
Okay, so let's go first, as you said. First of all, number one, take your medications. Check if the medications have been taken normally. Second, I love to have a mood chart. It may sound a bit nerdy, but have a mood chart. Always have a mood chart and try to see if there's any change in your sleeping pattern or in the way that you feel. Even with your social media, someone with psychosis may actually begin to chat more, or to chat things or to share images that you don't usually share. All that is like the footprint. Check your footprints. Then you have to take some precautions. Do not drink. Don't do any kind of alcohol, substances, caffeine. Decrease all of them, or the best recommendation, don't do anything of substances. Avoid stimuli, strong stimuli. Going to a concert, going to a massive experience, any grandiosity experience may be complicated. So try to be under the radar, keep it low. And at last, but definitely not least, make contact with a special person that can help you to keep you grounded. And it's a moment that you have to keep in touch with your doctor, with your coach, with your family member, with whom you have assigned for crisis. Always you have to have someone to have next person to call and say, listen, this is happening to me. So I've already called my doctor. I'm going to make this, and try to keep in touch with that person daily, at least one time. So if anything happens, then you can go to the ER, because as you said, if there's an acute, severe psychotic episode, definitely you have to go to the hospital. It's an emergency, because your judgment is not correct, because you don't have contact with reality as things should be, and you may take a decision that can endanger your life or others. It's an emergency, so you have to act fast, right?
Yeah, I really like what you said, and that's one of the things that I found was the most important, and also sometimes the most difficult, which was grounding myself as much as possible, or having others help me ground myself. So meditation, as much as I love it, and it's a maintenance tool for me now when I'm in a mania or I see myself going into psychosis, meditation isn't helpful. And that's for me. And I realize that, these are, I call them, like you call them footprints, but fingerprints for me. Like everybody has individual sort of signs. But for me to go into meditation, it's another way of expanding my consciousness. I don't need to expand my consciousness right now. I got to get back to me. So that's sort of the helpful thing. I am grounding food. So if you're not a vegetarian, meat, things like that. If you are a vegetarian, nuts, anything that can really sort of almost slow your system down, and things that ideally help me feel safe. So it could be being around a certain person. It could be being in my bed, if that feels safe. Sometimes being even out by the ocean is too much, surprisingly. Like it actually feels too expansive. So sometimes I'm needing to find sort of like just cozy little places. And just as that happens, what I call it is I recongeal, because I've been in this huge expansive state and I need to sort of recongeal into sort of, oh, all right, I'm back into my individual self. And yeah, so those are some of the tools I would say. Yeah.
Great tools, great tools. I would like to say one thing before we open, Emma, the Q&A, but I would like to say to all the audience, remember, it will pass, it will go. Because when you're feeling like this, or your family member has something like this, you feel that you're gonna lose the person, that you're never gonna have him back. Don't worry, it is temporary, you're gonna be back. And I also want to say this with all respect, because patients or family members may think that when you are in this state, you forget everything. Not at all. The time sequence may be complicated to remember exactly what was first, but you remember everything. And there's a lot of pain when you share these things. And I like the word that Emma gave at the beginning of this webinar, because I know that this conversation can actually hit you personally in difficult topics and matters. So you may feel very sorry about things that you said or things that you did, many things that you may regret. First of all, you're not guilty. You have to say sorry to yourself, to others, because it's a mental state caused by a chemical imbalance. So the only responsibility that you have now is to get treatment. And you know that this will pass and you're going to be fine. And also for the family members, you have to have the whole support and respect to the symptoms, and be patient and give always the space for them to open up and share them. Don't be afraid. It's great to talk them out.
Yeah. And the last thing I would say is that people, I can speak for myself, but when I was in psychosis, and I know other people have said this to me, not everyone, is that we're still conscious of what's going around us. And so if I'm being treated with disrespect or being denigrated or marginalized, I still experience that. And in some ways that can exacerbate the symptoms of what I'm going through. So to treat someone with a lot of care and compassion instead of dismissiveness and fear and things like that, it can go a long way to helping a person stabilize again.
Very well said.
Thank you so much for that really stimulating discussion. I think it was really great to correct some of the misconceptions that we might have about psychosis. Unfortunately, a lot of common knowledge is derived from media depictions, which can be incredibly stigmatizing and inaccurate. It was really interesting, Manuel, to hear you say that, you know, it's actually more commonly delusions that people might notice, and they may not actually recognize that as psychosis because of the misinformation that's out there. So I think it was great to have that sorry, that was my dog. To have that discussion about what you might pick up on and how you might intervene early, because it sounds like the odds are when you intervene early, there's a much more positive trajectory. And I'd also like to give some particular thanks to Victoria for your openness and your transparency, talking about your experiences, because I think as also has been brought up, that issue of stigma is one that, you know, impacts us at an individual and societal level, and I think is one thing that we're all hoping to change as part of this webinar today. So we're actually moving into the second half of our presentation now. We'll take some questions from audience members. As I mentioned, we've got a bunch coming in through the Q&A on Zoom and also on YouTube. We'll do our best to get through as many as possible, but please bear with us. It's a really interesting topic and we have a lot of questions coming through. So without further ado, I will move into a question. So one of our audience members has asked, what is the best advice that you have for a parent that has an adult sibling that has bipolar disorder type 1 and is currently in psychosis? He is alienated from family and close to being homeless.
Well, I think that the first point here is to make yourself present. To make yourself present, to let that person know, let your sibling know that that you want to help him, and there's help available always. Dealing with someone with psychosis, with an active psychotic stage, can actually be tricky because he or she may be kind of aggressive or not as open to receive help. So be careful, try not to be pushy, try to be patient, listen, first listen and listen and listen. You need to listen first. And then try to find like a space in which you can actually give help. It's like going fishing. You have to be patient. You have to remain stable and just be patient, and you will see the cue for you to jump in. What's the key point to say? I can help you, make you feel better, you know? Don't get into talking about the delusional, the idea. Don't try to say that is not real. If he or she pushes you to say, is this happening? Also, don't say it is not happening. You say it is happening to you in your brain. And I want you to know that I feel that you're afraid or that you're feeling happy for that. So they need to be empathized and they need to feel that you understand them. That's the first step. That's the first step. Seek first to understand and to listen, and then take action.
I think that's really, really great advice too. And I like that idea, like finding that moment of opportunity. And it's sort of like trying to find that common ground of being able to find help. And it might not even be about help, about getting, to the doctor. It could be that help getting clothes together or something, and just so that you can partner in a way so that there's a sense of trust, which certainly can not be present when someone is in a psychosis. And that idea of really listening and empathizing and being able to sort of, I liked what you said about being the stable, being that rock, so that you're able to listen and not be flustered by what the person is saying. And ideally, if they do sort of say, is this happening, or do you see that, or whatever, saying, I know that that's what you're experiencing. I don't happen to be seeing that or hearing that. I know that that's true for you. What can I do to make you feel safe? What can I do to help you feel better? And I really see that then there's creative ideas that start to percolate that way. So thanks, Manuel, for that.
Love it. Great advice. It's so, for me, it's great to listen what you think it's good for you, because actually you feel like that. And actually to listening to your feedback, it's great for me. Thank you. Thank you for your words.
Thank you. It's really great to hear the suggestions about how to keep that sense of trust and safety, which Victoria has emphasized. That's starting to sound like a really important thread throughout this discussion. I also just wanted to emphasize, care for the caregiver is also important if you're going through that kind of situation. Your own mental health and taking time to look out for your stress and the impacts that can have on your own well-being is also really important. And we'll have some resources to share in that toolkit for caregivers as well. Moving on to our next question. This one kind of relates to the issue of diagnosis, which, as we know from some previous talk PDs, is a very thorny and difficult issue to pass through sometimes. Is schizoaffective disorder and bipolar disorder with psychotic features always wrongly diagnosed? I had one manic episode that had psychosis, but my psychiatrist considered that a non-mood episode, and now I am considered schizoaffective.
Well, it's a very good question. And I think that schizoaffective disorder is a complicated diagnosis to make. Let me tell you why. Because you need to have psychosis, psychotic symptoms, without any mood symptoms. So you have to be very, very careful to see that you're not having at the same time either depression or mixed symptoms or mania at the same time. So that's the way that you make the diagnosis psychoaffective illness. Honestly, I wouldn't be worried saying that this is more dangerous or more risky. You may see this as a guide about what kind of medications are going to be used. In this case, an antipsychotic should always be present, because you can have those symptoms without any fluctuation in your mood. So that's the difference. That's totally the difference.
Yeah, I can't say that I have anything to add just because it's not my area. It's out of my scope, shall I say.
Sure, thank you, Victoria. We have a couple of questions coming in about the relationship between psychosis and various mood states. So I'm going to bring up one of these and hope that that kind of the discussion about the relationship with these hopefully answers a couple of the questions on this topic. So this individual asks, when I'm depressed, I never experience psychosis. For most people, this is also the case. I feel that as long as I keep my mania under control, I'm able to avoid psychotic symptoms from creeping in, which usually comes at the severe stages of mania. Antipsychotics won't work because it is the mania that triggers the psychosis. Do the panelists agree with this?
Well, that is the most common thing for bipolar 1. But remember, it's bipolar disorders in plural. So we have bipolar 2, which you can also have psychotic symptoms, especially in the depressive episodes. But you can also have patients with only mania. So there are different areas of the disorder. I noticed in the chat one question that they say, isn't psychotic the highest level of mania? Not necessarily. You may have delusions or you may have any kind of psychotic symptoms with mild mania. So don't be fooled by this. People are confusing frequently that you have to be on a full-blown to the top mania to have these symptoms. And not at all, not at all. It is common, yes, but it's not the rule. So be careful.
That's really good for me to know, because my experience has been when I'm in a full-blown mania, it goes into a psychosis. But hearing that it's not always the case is really, you know, it can be the exception to the rule. And I know people who have been in depression, and it's interesting. I guess we just don't know why some people go into depressive psychosis or manic psychosis. But yeah, so mine has always been in the on the manic end of the spectrum.
Which is the most common, but don't be fooled by that. That's just my point here.
Thank you. It's a complicated relationship to pass out. And I'm wondering if kind of additional to that, Manuel, you can also comment on whether or not psychosis is always influenced by mood state, or whether it may be incongruent with mood state. That's another kind of common misconception that I think comes up.
Well, Emma, you know that as a doctor, I can never say always or never, but I can say that most of the times, yes, it is congruent with the mood. And that's the most common thing that we see. But as I said, every day I see more mixed episodes. So that's tricky because you may have a clear manic episode with some mixed depressive psychotic symptoms. You may have that combination. Remember that mixed episodes every day are more frequent. So we have to take in consideration that. Bipolar disorder is not going to change the name, but I think that the name can fool you sometimes, that you have to be in one pole or the other. Every year we see that the frequency of mixed episodes is increasing. This may be because of medications, antidepressants, even drugs can actually make the illness more mixed, you know, and that's a pattern that we're seeing now, that episodes are more frequently mixed and more frequently with psychosis. So that is something to take a note.
Yeah, and my most recent psychoses, the last two, where it was mostly in mania, but then there were a few features that were really sort of that more paranoia or fear kinds of things that, and I hadn't experienced that before. And so I was seeing things that frightened me. I was, you know, believing things that didn't feel good. And then I sort of go into sort of more the euphoric kind of experiences.
Oh, thank you for sharing that. And thank you for the additional elaboration, Manuel. I think it's really important when talking about these overlapping experiences. The next question that we have is from somebody talking about We've had a lot of questions about how to prevent psychosis come up. And this person's asking about how to cope with and adjust when it has occurred. So they ask, the aftermath of my first psychotic episode was the hardest thing I've had to deal with. My friends and family never looked at me the same. It was no longer just mood swings. Can the panelists share tips on recovering from psychosis episodes and adjusting back to life? Thank you.
It's a beautiful question, Emma, and I was actually going to bring it up. I want to divide my comment in two parts, because I want to also talk about the caregiver. Maybe let's begin with the caregiver. You just said about the burnout, Victoria, and it's totally true. You experience burnout syndrome when you're dealing with someone with psychosis on many weeks, you know? It is stressful. It is tough to see your loved one believing or seeing things that you don't see them. You know, that can be stressful. So you need to decompress. You need to open up. And the caregiver should always be aware of their own health. So that's a key point here. Then I want to say to the caregivers or to the loved ones that yes, it may be difficult to deal with all this information, because in the delusional state, your loved one may call you in a bad way, or may say to you certain things, or may be even aggressive or bring things that you were really hurt. So try to understand, and to heal those feelings, because they were verbalized or acted through a psychotic state. And this connects with my advice for the person who has suffered this. I think that word aftermath is critical here, because yes, you feel the aftermath, and it can be devastating when you cherish all your life for something, or you take care so much of someone that you love, and you realize that you hurt them through all this psychotic crisis. So first of all, forgive yourself. Understand it's a common condition in your illness. Get information and digested all the information so you can share it with the people that you love, and try to explain them this. Use webinars like this to share them. This is an excellent idea, to send the link to someone else and to share, this is what happened to me. And this is the explanation why I said those things or why I acted in that way. So forgiveness is the main word here. Forgive yourself and forgive the others.
Yeah, those are really, really good points. And I think it is a really good word to use, as the aftermath. And my heart goes out to you. I experience the same thing. There's so much shame that comes along with it, not only for the things that we do or I did, but also just the fact that I was in psychosis, and psychosis felt like the most uncontrolled state I had ever been in, because I was doing things I would never have done. I mean, I ran down the street naked in a psychosis, and was promiscuous in ways that I, things that I just normally would never do. And so that idea of self-compassion, as difficult as it is, and really trying to understand that those actions, and this is where I think there's a disconnect, is that how can my actions, which I normally have so much control over, be part of a condition or part of an illness? And so understanding, just like when you see someone who's ingested too much alcohol, they act totally different than how they usually are. And that's how I try to reconcile it. Therapy was really helpful for me, because I felt like I had lost a lot of my identity, my self-confidence, my self-esteem. I did go and apologize to the people I needed to, which was hard, because at the same time, I wasn't guilty, but I was responsible, and not really responsible, but it was me. And sometimes the people who I apologized to wouldn't accept the apology. And that was even more difficult. So it was really important for me to have a therapist who I could sort of debrief with. And it was an ongoing process. I wouldn't say ongoing, but it was a process. So it happened, that ability to forgive myself, the ability to care for myself occurred over a number of months. And as I got more clarity about what the illness was for me and more self-care, that's when I was able to sort of let go of some of those more, what I felt in the beginning were shameful things.
Thank you, Victoria. Thank you for sharing. And I think that you're being so honest with all of the audience. And I do think that sharing all those things actually move us to understand the feeling of shame, that you shouldn't be feeling like that way. And I think the feeling of not having control of your actions, that can be actually scary, when you look back and you said, I didn't have the control that I know that I have, the restraints that I usually have. So it's totally understandable. And listen to this, I can tell you that many patients don't want to bother their doctor with these things. And this is so relevant. That is why therapy is crucial here. You need to open up and you need to share these things and you need to digest and understand the illness in this way and try to find your identity outside of the illness, because that can be overwhelming to understand how you make decisions in a psychotic state, and you decide for things and you take action that you usually don't want to do it. So thank you so much. I definitely appreciate your words, and big hug from here, Victoria.
It really means a lot to be able to share this. I mean, I feel like I would love to hear other people's experiences because we just don't talk about it. And the more we can talk about it, the less isolated we'll feel, I think, and the more understanding we'll have of it.
Thank you both for your really sensitive responses to that question. We talk a lot about self-compassion and compassion towards others when dealing with the impacts of bipolar disorder. And it seems like this experience in particular is one where that is an essential skill to practice, and it doesn't come naturally to all of us. So getting support where you can in terms of a therapist or a trusted family member or friend is going to be really important.
Yeah, and Emma, I just wanted to say something really quickly, is that self-compassion wasn't something that I could manufacture. I needed other people to hold that compassion for me until I could be compassionate towards myself and model that for me. So as more people accepted me as I was and with what I had done, then I was actually able to do that and internalize that. So also don't give yourself a hard time if you're having trouble being self-compassionate.
Yes, that's the paradox, isn't it? Let's not get critical for not being self-compassionate enough. Sometimes somebody else in our life just needs to be responsible for watering that plant for a little while until we are in a position to do that ourselves. So thank you for that note. We have a question here about treatment and what's kind of needed for the experience of psychosis. If I hear voices that are not aggressive and I'm able to manage them, do you still recommend treating it? I'm afraid to let my doctor know as I feel I will overreact. Will it worsen without treatment or over time? I don't want to take antipsychotics if I'm able to manage the voices.
Well, I think that this is a critical point here, because you may find them not that threatening for now. But I think that first of all, you should report them to your doctor. And yes, I would advise medication. Don't be afraid. Probably he's going to prescribe a low dose antipsychotic. You don't need like big doses. This is very common in my practice. Let's suppose that I have a patient with lithium and valproate or with quetiapine. I add like a squeeze of aripiprazole. That's what I said, like a squeeze of lemon, like just a tiny dose of antipsychotic can actually hit those symptoms and make you feel better. You don't need to be listening to those voices.
Yeah, I don't really have anything to add to that because I don't feel qualified to.
Okay, thank you for your comments on that one. I think that kind of fear of what might happen if you seek help is a really important one to demystify. And if you have additional questions about medication, we do have an earlier talk BD on that topic, which hopefully we'll link to at the end.
I can add one thing, Emma and Manuel, is that if you are afraid of reporting it to your doctor, but you feel like it's still worthy of doing so, take someone who you trust in, so that they can work on your behalf as an advocate or alongside you. And then also you'll be able to soundboard about saying, so what did you think about that? Do you agree? Or, you know, so sometimes having another set of eyes. And I did that when I had become on good terms with my parents once again. And my dad was a real strong advocate for me. So that's also an option. So you don't feel like you're having to make these decisions alone.
And you should view medications like getting prescription glasses, you know. You need to get the correct measurement, you know, because every brain is different and you need to get the combination of medications to give you the 20/20 vision, you know, the quote unquote. That's what we are looking for. So don't try to compromise feeling like that you're like being afraid of getting another medication is going to make me feel better. Worse story. Totally the contrary. It's going to make you feel better. It's like getting better glasses, you know, that's the whole point. So that's the point about opening these things up.
Thank you for sharing that. And I agree, the having an informed supporter that you can trust on your side is really important. And again, in that Talk BD on medication, we talk a lot about making sure you have the right fit and relationship with a clinician who can kind of explain things in the way that Manuel is doing. I think we'll have time for a couple more questions. What are your thoughts on psychosis being a result of early childhood trauma and the delusion themes in psychosis being connected to that?
There is a relationship, and actually I would like to bring this topic also, that there's like this connection between crisis and crisis, that some people actually have same pattern of delusions or words or hallucinations that are present in this state, you know. They may be connected with trauma or with the feeling that trauma had, persecution, paranoia, religiousness, you know, like they may be connected in a way. But don't be confused by all those things. They may sound scary, but the point is, the bottom line is you need treatment. They can go away. And I think that the key point here, and I didn't say this word before, the word is change. Remember that in bipolar, and I love interpersonal rhythm therapy, social rhythm therapy, that you keep track of all the schedule that you have daily, your daily schedule, your social schedule, the moment that you wake up, the moment that you text someone, the moment that you meet someone. So when you know it is a change, any pattern that is changing, that may bring us something to look at. You know, like the key point here is look for changes and try to act as soon as possible. Don't get afraid of the topic or of the symptom per se. Go get treatment and you're going to feel a lot better.
Yeah, and I could speak to that around the connection with trauma in my experience. And I, interestingly, had done 2 fairly intensive workshops, one about relational sort of attachment, complex PTSD, and another one that was similar many years ago. And both times, I obviously didn't learn from the first time. My system was so overwhelmed that I went into a psychosis. It just opened things up too fast. It overwhelmed my system. And I think, and not to say that, you know, you can't do workshops or anything like this, but what I realize is that if I'm not processing my past trauma, it can affect how well I can manage my mood disorders. So that's why I see that it's important to not just have my medication and my self-management tools, but be able to work through trauma so it's actually out of my physical system. And it makes it less likely that depression, mania, or psychosis can be triggered. And I really have no evidence for this.
No, but it's 100% a great point. And let me chime in because I think that absolutely comorbidity with PTSD, with anxiety is so frequent here. And I think that you should get treatment for those issues. And this can actually improve your quality of life and it can actually decrease the risk of psychosis. It's an excellent preventive measure. I agree 100%. And if there's someone who had experienced trauma in their past, any kind of abuse, as you know, it has many different patterns. You should work that out. You should talk it out in a therapy, and it can actually lower your risk of getting a psychotic episode. Absolutely, definitely, you're right.
It's just
Thank you.
and it's just a matter of pacing. So when I did intensive workshops, that wasn't the way to deal with my trauma. It was about titrating and doing it very slow.
Yeah, it really connects back to that theme of trust and safety that you've been bringing up, Victoria, and recognizing that that's important to have in that therapeutic relationship and the work that you do as well. We have time, I think, for one more question. This is looking towards the future. Are there any emerging or new treatments for psychosis? I've been tested on everything all the way from clozapine and regular ECT, but they only work temporarily and the side effects are manageable. And I know that one's on treatment, which Manuel might be able to speak to. But Victoria, I'd love if, looking towards the future from your perspective as a mental health speaker as well, what's changing in terms of stigma, what kind of positives we might have on the horizon for people who are experiencing that. So I'll hand it over to you both.
You want to begin, Victoria?
Manuel, I was going to say, maybe you could answer it first, and then I'll just build on what you say.
Okay, whatever. I think that I want to begin not with the medication, because I do think that the changes that we're having now in fighting for stigma and being open, it's crucial. And I think that we need to open these things. For me, that's crucial. Even more than medication, I think that we're changing as being more perceptive and more open to this symptoms. For me, that's the biggest change. A change in mental paradigm, in being open. Remember, it's a mental illness. There's nothing to be ashamed. And you should view it exactly as other medical illness. Second, yes, antipsychotic medications are getting better every year. I do think that the key here is to find the combination and the way to treat them. Some mood stabilizers like lithium may also work, and other new therapies may work. I think that you have to keep updating, having your appointment with your doctor and find about those new treatments. But I do think that medications are getting them more accurate every day. Remember something, it's not going to be one medication only. It's a combination. It's a complex illness. So we are never going to see the miracle drug. We're going to see a combination, and a combination that is the exact amount and pattern for you. The prescription glasses is a good example, because you need to have your own prescription. That there's not going to be like a new miracle drug. It is a combination. That's my first 2 cents.
Yeah, and I would just echo all of that. The fact that we're talking about it, the fact that you can ask that question, the more that we can normalize it, in some ways we'll have a society that's more accepting of it. That might make it easier for us who experience it to be in this world, first of all. And I guess this isn't necessarily something that's for the future, but building on your quality of life. And I don't say this dismissively, because I really, my heart goes out to you when it's very difficult and you have unmanageable side effects from things. Being able to find those things that really create meaning in your life, despite having side effects, symptoms, things like that, even if it's difficult to do. And for myself, sometimes what happens is I'll be in the midst of an episode, not an acute psychosis, and I'll still be able to take some action, sort of like what that interpersonal rhythm therapy is, where, I still can keep that routine and do the things I know in my memory that I used to enjoy. And then somehow it can sometimes trigger it. That doesn't necessarily manage the symptoms, but it can raise the bottom of the well, so to speak. So I'm not at the bottom of the well and a little higher in the well. So
thank you.
A little bit.
That's really important final insights to share, both in terms of stigma and what we can do as a society, and in terms of keeping that broader quality of life perspective in mind. I'm aware that we're a little close to time, but I thought that was a really important final question to look forward to, because it really is important for us to find a little bit of hope in dealing with this quite heavy topic. So once again, thank you to Manuel and Victoria for sharing your time and expertise. I'm going to quickly move through some resources that CREST-BD offers and flag some of our upcoming events. So we have put together a document shared in the chat that contains links to resources that might provide additional help and information about psychosis, both if that's something that you've experienced personally and if you have loved ones going through this experience. And this will also be available after the presentation in the YouTube comments. As I mentioned, the trial of our Polar smartphone app is open. This is open to people living in Canada or the United States, and it is going to be sharing information and strategies that you can use to help optimize your quality of life. So if you're interested, please sign up in that. We also have a study up about the impact of intermittent fasting and bipolar disorder symptoms. So if that's something that you've tried out, please do let us know how you found us in that link. We also have links to our other CREST-BD resources in that kit, including our Bipolar Wellness Center, which contains more information about self-management strategies to optimize your quality of life. We have our academic CREST-BD website, which is where you can stay in the loop about our research projects and also sign up to our CREST Currents newsletter to hear about upcoming events. We've got a Talk BD scheduled on December 12th at 7 p.m. Central Time with Dr. Sherry Johnson. And this is going to be a really exciting and interesting discussion about the links between bipolar disorder and creativity. Today's talk and all of our previous episodes have been recorded, and you can see them on YouTube, as well as listen to the recordings on Spotify, Apple Podcasts, and Google Podcasts. Please do let us know your thoughts about the event. It helps helps us improve them, and also helps us to know what topics you'd like us to share about in future. We'd like to thank all of those who are funding our work and our partner organizations who have helped us out with these events. And if you'd like to stay up to date with our work or the work, you can follow CREST-BD on various social media platforms. So once again, thank you to everyone who's attended and to our presenters, Manuel and Victoria, for their expertise. Until next time.
Thank you.
Congratulations.
Bye, Manuel.
Happy
Bye,
to come back.
everyone.
Bye-bye. Bye,
Thanks,
Victoria.
everyone.
Bye, Emma.
Bye.
Thank you.
Bye.